very good morning. Thank you for being here, Dr. Helena and Zemedu. We're very happy and very thankful for all the support and work that you have been doing with REACH in Ethiopia, especially for key vulnerable populations and using AI technology to screen for TB and other lung conditions. How you came about thinking about AI X-ray for your project? Have you used it in the past? Is that something? What has that experience been like for you in the past 1 year?
Okay, so I'll just give you a brief introduction and then Zemedu will continue. So we were the first organization to procure the X-ray with AI guided as a country. Yeah. So we were the first, and we had the chance to really work throughout the country. We have worked throughout the country in the urban setup, rural, pastoralist, agrarian. So we were lucky enough to implement that and almost for 18 months and have gathered the needed information so that we can use AI for future users as well. So I think we were fortunate enough to have had the collaboration with
the REACH TIP experience is the first experience for the country.
Yeah.
There was a plans to be introduced this AI at the ministry levels, particularly for the prevalence survey, but it couldn't happen because of different reasons. So the REACH TIP AI-based screening is the first one, and it covers a lot of geographical areas, including the pastoralist areas, that is very hard to reach areas, and the rural areas, urban settings, and so on. So we don't have such kinds of experience in a country levels that have a vast geographic coverage, as well as reaching different kinds of TBK affected populations. So for Ethiopia, that is the first experience in implementing of AI-based TB screening at the community levels. There are some pilot studies, but they are very few.
Understood. Now, also, what has been your experience, Zemedu, on the field, using these tools and also making that data and information that's coming in more meaningful for your programs? Because I know for a fact that a lot of programs usually suffer by not having this meaningful data that they can use to inform their projects and policies. So how has AI actually assisted that decision making and data use in your project?
Yeah. Before, we were using the radiologist by using a digital X-rays that is fixed on the vans, and we send the image to the radiologist.
Yeah.
That takes up to 1 week and so on to get the results. So it was a big challenge for the clinicians because they didn't get the result earlier and so on. When we get the AI-based screening activities, we have some lessons, and that helps us to enhance our community-based screening activities. And this is a core idea for the new project. So at Learn, most of our activities is built on the AI-based screening.
I also know that the current project where you are doing active case finding across different population settings, I think there's a close to 12,000 population that has been screened under that project. Has your experience been different to roll this technology in urban areas and in pastoralist areas? Has that experience been starkly different, and how have people accepted or rather responded to this new technology in these different rural, urban and pastoralist settings?
I think surprisingly the acceptance rate throughout the country is very much welcome. Yes, be it on the urban setup or pastoral setup, the acceptance by the community is very much well appreciated. Because we can be able to reach the community within their community. So I think that's one of the important impact that has brought. And just to add on the previous one, the evidence that we have generated has helped the Ministry of Health, the National TB and other lung disease program as a country to adapt and be able to procure more chest X-rays with AI-guided systems. So I think that's one of the breakthrough for us as a country.
Absolutely. I know for a fact that the ministry is giving a huge push and support for innovative technologies, especially not just for active case finding and making sure we don't miss populations and key vulnerable populations, but they're also keen, like you said, to use innovations beyond the disease silos. They want to make sure that any innovation that is catering to people can look at a number of care areas and give most health access and equity to the patient. So right now, I know the focus of Reach Ethiopia is TB, but in the long term with COVID and all these new emerging infectious diseases and respiratory issues, what kind of potential do you see a technology like this could have in the country for, say, integrated care or multi-disease screening?
I believe we can use this for a whole lot of integrated things for other lung disease screening, be it lung CA, other lung disease, post-COVID, and the like. So I think it has opened a huge door for us to explore. But in addition, with the AI system, I think it's a way of showing we can use it for a surveillance system, we can use it for a telemedicine. So it's just a very small opening, and we can diversify it for a whole lot of use, I believe.
Fantastic. I also understand in the study that you have, which you have done on the project, that there is a great concordance that we have seen also of the innovation with the physician and radiologists that are reviewing the data. I think close to 95% concordance in that data. So how was the experience of a radiologist using this technology? Because there's always a skepticism by users of such technology that it will replace my job. So has that been the same experience, Zemedu, or have you seen a more acceptance on this from the parties?
Yeah, from the Qure side, the technology have a good acceptance, and it also helps us to enhance our screenings. The community is working with the symptom-based screenings because frequently the health extension worker, the health care providers ask the symptoms and they didn't say anything. But when we introduce the X-ray based screenings, that increase the community interest to be screened.
Right.
And we have seen a good acceptance from the community side. From the healthcare provider side, particularly from the radiologists and the sons, there is some doubts about the AI accuracy. But we have some evidence. We compare the radiologist reading findings with the Qure AI reading. So we didn't see a significant kinds of variations. So even we see a better sensitivity, which is good for the screening purpose based on the AI findings. So for the screening purpose, our data confirm us the AI-based screening is better one. For the confirmatory, the radiologists may be important. Otherwise, we didn't see any kinds of significant kinds of variation between the radiologist reading and the AI reading. So the next step should be advocating about the AI, particularly for the radiologist team.
Correct. So that's the next question I was coming. There's a huge amount of upskilling, capacity building, ownership from the community on such new innovation. And Reach does extremely amazing work working in the community with the people. So people-centered care, bringing access to them. I know AI can play a big role in this, but what has been the biggest challenge for you in the project to actualize such innovation in field?
I think the first thing is, as Zemedu was mentioning, even though we have evidence, as we have talked about it, we have done this in almost a year in 15,000 population group in different settings. Yet there is still some resistance from the radiologists to accept, thinking that their job might be taken by the AI, but that's totally different. We just use this Qure AI system for screening purpose. So I think that's one of the challenges. The other challenge we have faced is capacity building. So we don't have that much people that are trained to actually use X-ray with the AI system. So I think that has been one of our biggest challenge. And especially recently, it has somehow hindered us to allocate this X-ray machine in different settings because of the capacity building sorting. I think the other one would be we want, as we were talking earlier, we want supervisors for childhood cases. As you know, we are doing this for children, for adults above 15 years, with the exception of contacts, childhood contacts. So we want to try this for community groups for children. So if these challenges are somehow, taken by the AI or the whoever, then we would be happy to try this more and show more evidence as well.
Fantastic. So I know a lot of innovators out there spend a lot of time with communities to upskill them, use it, handhold and support. And I'm happy that, while these are challenges, that the WHO has been very encouraging, to use this technology in the field, especially where there's lack of human readers. So the inherent goal of such AI technologies for imaging and screening is of course not to replace, but how can we make sure that places and regions that don't have access can have this access, and we can support readers to optimize their work with the use of AI. So great, thank you for that. And I think another important question I had is, we understand that the ministry has a fantastic focus on targeted TB strategies, and key vulnerable population is one of them, and pediatric and children have a huge mortality rate. So these are some areas that we as an organization also look at in terms of how can we optimize our products for these key vulnerable population. What has been the experience of you using this also in the prisons in Ethiopia? I think that is one of the most neglected segment of society, where people living without liberties or deprived of liberties get access to TB screening services. What has that experience been like?
Regarding to reaching the unreached population, Reach Ethiopia have a good experience with do screening at prisons, pastoralist communities, and other unreachable communities. Regarding to children's, screening is done still based on symptom-based screening, which is not a good sensitive tools, and the TB detections among children is very low, particularly where Reach Ethiopia had a project. So we try to introduce a new kinds of approach by using advanced kinds of testing tools, and we also have initiatives to improve the screening procedures. So if there is a new kinds of approach that enhance screening among children, we are very willing to.
Fantastic. So of course, I'm sure our team can help on that. But beyond this, is there any kind of advice that you could give us? Because we are fairly new. We are building these innovation technologies in partnership with partners like you and Reach team. Is there any advice you can give us to make our products and services better for the community?
I think one of the things, in addition to the mobile ultra-portable X-rays with the AI system, I know it's also innovative to have the AI system and already mounted X-rays within facility level, so that we can not only use this for TB but for other lung diseases as well, and be able to capture a huge number of people with other diseases. Even for the cardiac cases, it would be nice to include it both in the mounted X-rays as well as the ultra-portable X-rays. So I think going forward, one of the key things the AI system should be focusing should be on having a diversified disease indices to be included in the list. And the other is also to think beyond the X-rays, that is to have, as I said earlier, to include in telemedicine to help us gather the data for different surveillance data. So that I think that would be one of the key messages that we wanted to make.
Fantastic.
For that.
Fantastic. Thank you. Yes, sir.
The integrations of many comorbidity is very important.
Integration of comorbidities.
So I think Qure have already started. It have TB, lung cancer, and so on. We recommend to add pneumonia and other lung diseases. That makes the physicians work more easy and increase the accuracy of the diagnosis. In addition to that, I recommend to do some advocacy works, particularly with associations like radiologists associations and so on.
Correct.
to promote these kinds of technologies and the utilization of these technologies. And it is better to pass through research activities to improve the accuracy of the eyes.
Yeah.
Yeah.
I think that on that, it would be good to capacitate the radiographers as well.
Yeah.
So if we capacitate them on the AI system as well as the X-ray method, then maybe we will have a much more bigger pool to take whenever we want to use these individuals, and as well as use them as an advocacy tool as well. So I think that would be capacity building with the whole
I think that's fantastic. I mean, you're not just enabling the people who the technology is using, you're also upskilling them on a constantly, so that you have a huge human resource within the country that can be used and provided for public health services. So that's fantastic. I think as an organization, we are committed to bringing technology not just in the field and to make sure we catch missing cases and provide care there. As you said, we are very happy and keen to also provide this in existing hospitals where there is infrastructure, and how we can augment and improve this infrastructure without a huge dent on the government treasury or on budgets within the country. So I think that's a great idea. Thank you, Zemedu. We do work a lot with societies, but there is always an opportunity to get the champions to be from the radiology team, our radiology physicians. So thank you again for all the support that you've been doing and being part of the journey to bring TB to end TB. And thank you again for being part of this interview.
Thank you so much for having us.
Thank you.
Thank you.
Thank you.